qualifies for bariatric surgery? Well, this is a great changing question. For the longest time, bariatric surgery had one standardized criteria for weight loss. Patients would have a BMI that would be greater than 35 to 40 with a medical problem, or a patient that had a BMI of 40 and higher, even without a medical problem. So first question is, what is BMI? BMI is a calculation of your height and your weight. Easy to find this out. Go to Google, type up BMI calculator, and put your number in. So if your BMI is 35 to 40, you would need a medical problem. What are those medical problems? Hypertension, diabetes, it could be a fatty liver, it could be sleep apnea. There's a copious amount of medical problems. It all depends on your particular insurance. If that BMI is 40 and higher, typically you automatically qualify for bariatric surgery. Well, since the introduction and the widespread use of GLP-1s, insurance companies are understanding that they're actually losing money by patients being on GLP-1 medications. There was a recent study that showed 9 months of GLP-1 medication for insurance companies are equivalent to bariatric surgery when it comes to cost. So what they're doing is they're lowering the cost and lowering the BMI of bariatric surgery to patients. Why are they doing this? Well, another step is that although GLP-1s are widespread, unfortunately, because of the cost, the side effects, or just plain being a medication you have to take forever, if you ever get off that medication, your BMI typically goes back to what it was prior to the medication or even higher. All the studies have shown that. So what insurance companies are seeing is that they're spending a lot of money on medications. Well, those patients 6, 8, 10, 12 months are still going back to needing surgery. So those new criteria, and once again, this is really dependent on your insurance, can be as low as a BMI of 30 with a medical problem that would qualify for surgery. So the best way of knowing your criteria, if you have insurance, is for you to look up your insurance and call your insurance to see what the criteria is. If you're a self-pay patient, the criteria is what is accepted by all the international guidelines, which is a BMI of 30 and higher for patients. So let's say now we have qualified for surgery. We've noticed that went through your insurance. Let's say you're having insurance. We have deemed that you have the appropriate BMI, medical problems, and your insurance covers surgery. Where do we go next? Well, the next step is to come see me. I can see you either virtually or in person, and then we go over not just what surgery you're gonna have, but what we're gonna do before surgery. Why is this really important? Well, not one operation is good for all patients. There's certain patients that have different criteria or they have different goals of what they're trying to achieve. It's different for a patient with a BMI of 60 that's healthy than let's say a patient has a BMI of 40 with significant diabetes. That patient is different. Let's say a patient has really bad reflux. Maybe that patient I'll look at differently than a patient without reflux. So it's really important to one, go to a surgeon who does every operation, that is the sleeve gastrectomy, gastric bypass, duodenal switch, single anastomosis duodenal switch, as well as any revision. Therefore, the operation that you choose isn't the one that is dependent on the surgeon, it's dependent on you as an individual. So now I've seen you in the office, we've talked, we've now come to line of which operation, we've talked about the benefits, the risks, and the pros and the cons, and we've chosen the operation.